All right. Well, welcome everyone. Thank you for joining us, whether it is your morning or afternoon, as I know we have folks with us today from all across the country. My name is David Helene. I'm the founder and CEO of Beam, and I have the distinct honor today of introducing our discussion around how states can consider strategies for implementing new HR1 work requirements in a way that acknowledges the extremely difficult and punitive compliance regime we find ourselves in while trying to preserve access to SNAP and Medicaid for the tens of millions of individuals and families who so rely on these critical resources. For those of you not familiar with Beam, we are a technology partner that helps governments and nonprofits administer various public benefit and cash assistance programs all across the country. We've helped administer over 350 million in benefits on behalf of more than 200 governments and organizations over the past few years. And I will share at the end a solution we've developed to help agencies specifically respond to the complexities of these new work requirements. Before that, however, there is much to unpack on ABOT compliance. As I'm sure many of you have, I have been on the conference circuit the past couple of months, including multiple APHSA conferences. And what has stood out to me is that while the urgency of the moment we find ourselves in is lost on no one, as most states are expecting to have to comply by November 1st, we remain early as a community in identifying true best practices for grappling with and implementing these new work requirements under HR1. With that context in mind, I'm really pleased to be able to introduce today three esteemed colleagues who are experts on SNAP and Medicaid, and who will be able to share strategies that states and counties, in partnerships with local nonprofits, can use to navigate this new federal landscape and ensure that eligible individuals are not falling through the cracks. Just a few housekeeping notes before we get started. We would love to encourage you to engage throughout the webinar, so please introduce yourself in the chat. Use the Q&A function for any questions that you may have. We will have dedicated time at the end to address them. And with that, I am thrilled to introduce our panel today. Joining us, first, you will hear from Ed Bolin from the Center on Budget and Policy Priorities. Ed is the director of SNAP state strategies on the food assistance team. He applies his versatility and technical know-how in developing the team's SNAP state policy agenda and provides strategic guidance and TA to state advocates and federal and state agency partners. Prior to joining the center, he worked as an advocate in California on food policy, public health, and childcare for low-income families, and Ed will talk through considerations, particularly on time limits and work requirements as they apply to SNAP. After Ed, we will hear from Alicia Kone, owner and president of Kone Consulting. With over 25 years of experience, Alicia is a leading expert on public safety net programs, and her experience as a former director of the Washington State SNAP program gives her a deep understanding of these issues. As someone who has personally navigated these systems herself as a single mother, her career has been inspired by a lived experience that drives her to make services easier for applicants and participants. Alicia will be providing strategies as it pertains to understanding ABOT holistically, particularly on the SNAP side. And last but certainly not least, you will hear from Elizabeth Lauer-Bash from Gray Cat Policy. Elizabeth is a national expert on public benefit programs with extensive experience working to improve programs and reduce administrative burden in both government and advocacy centers. As I mentioned, she is currently consulting at Gray Cat Policy, and you will hear from Elizabeth on preparing for work requirements as they pertain to Medicaid. And with that, I will turn it over to Ed to get us started.
Great, thanks so much, David. Again, Ed Bolin at the Center on Budget, and delighted to be here. Great to see so many folks. And we're on strict time limits ourselves. So I'm going to jump right in and talk a little bit about, set the context about who we're talking about and why it's important to make sure policies are correctly applied so that only those who are subject to the time limit end up subject to the time limit. Then I think we'll talk more about implementation, talk a little bit about the future for Medicaid, and David will wind up with a presentation that helps address one of the many complexities of the time limit. So I wanted to start with who we're talking about, though. And the folks that are subject to SNAP's time limit or work requirement are actually among the poorest folks on SNAP, which is saying something given that SNAP has income limits, as we all know. They are quite poor. They're often not connected to other benefits or have other resources to avail themselves. And the other thing to note is that many of them work. They work when they can. They may not be working for a while. They're on SNAP. Sometimes it takes a fair number of months for folks to find employment, especially if they face barriers to employment. And studies of individuals, interviews, and conversations with folks have revealed that a lot of people face barriers to employment. I put a few down from a great study years ago from the Ohio Association of Food Banks, showing folks are very young, some are exiting institutions and may not have supports in their communities. Many don't have high education levels or may have limited English or literacy challenges. Lots of folks don't have cars. Some folks don't have driver's licenses. So put it all together, and folks really face a number of barriers to finding employment, which is a condition under this time limit. The other thing I'll say is just to put it out there that the time limit in SNAP really doesn't work to achieve the goal of getting people increased earnings and more employment. On the right, there's a couple of little snippets of states where the time limit came into effect at a point in time. That's the red line you can see. And really, the only point to note is that participation in the program plummeted right after the 3 months after the time limit was put into effect. So we know one of the outcomes of the time limit is loss of SNAP and the increased hardship that goes with that. We also have research showing that the time limit does not increase earnings or get people jobs. So it really just puts people in a bind if they can't find a job. The final note I'll make on this slide, though, is just it's also a very complicated rule in SNAP, and that's of immense concern, I think, for state agencies as well as community partners and individuals subject to the rule because of changes coming due to the reconciliation mega bill, which I'll touch on briefly, and I think we'll talk about more in other parts of the day. So what is this rule folks are subject to in SNAP? People get 3 months, 3 full months of benefits over a 3-year period. That's why we call it a time limit. You get 3 months, then you're cut off if you can't find a job or are found exempt or otherwise remain eligible. There's ways that folks aren't subject to this time limit. One is if you're in a waived area. I'm not going to really touch on that. It's unfortunately not an option for a lot of states going forward. You're also not subject to it, though, if you meet an exemption. And I will go through those because those are really critical for states to identify individuals who meet those exemptions, and given the changing circumstances in their lives, important for states to stay on top of the exemption status of an individual. Or you can meet the actual requirement to keep benefits. That means working 20 hours a week in a training slot, 20 hours a week. There's certain rules around that. We may dig into that a little bit. Combining that for 20 hours a week or doing workfare, which would be a different amount of time. I just want to note that under the rules in SNAP, work means paid work. So there'd be earnings to have, but also unpaid work, volunteer work, and in-kind work. So for instance, neighbor care, taking care of a neighbor, mowing a lawn, helping a neighbor out who's hit a hard time, can and should count for an individual. And state agencies and eligibility workers need to be able to find an easy way to connect folks to all the different ways they can qualify, as well as all the ways that could be exempt. Next slide. So just going to touch briefly, even though this is kind of the elephant in the room, the changes that are coming because of the reconciliation bill, the mega bill that was passed July 4th. First off, biggest cut in SNAP's history, fundamental transformation of the program. I'm just going to focus on two pieces. One is the changes to the time limit, the expanded number of people subject to it. But the other one I want to specifically mention, because it drives so much of what states can do, is this requirement that states have very low payment error rates. Otherwise, the state itself, the state budget, has to put up a portion of the SNAP benefits. That's a historic change. Used to be 100% federal benefits. Now states have to pay if their error rates are hit certain thresholds. So states are really obsessed about getting the payment accurate. No overpayment, no underpayment is a good case. So that's going to drive a lot of the policy considerations and the way these rules roll out, because states will focus on it. I'm not going to dig into that in detail, but it's kind of lurking behind everything I say here. So the changes to the time limit are that for the first time ever, parents with children who are 14 years and older are subject to the time limit if they don't have younger children. So if you have a child younger than 14, still not subject to the time limit. But if you don't, if your child's 14 and over, subject to the time limit. Also raises the age limit from currently 55 to 64 years old. So older folks who often struggle to find employment when they're unemployed will be subject to the time limit. And then some categories of folks who were exempt, like veterans, people experiencing homelessness, folks aging out of foster care, will again be subject to the time limit. But states will be required to identify if they meet an exemption now that those particular exemptions are gone. It also restricts waivers in areas where there aren't jobs. That used to be a great resource for states. It's now very limited. And then finally, it creates a new exemption for Native Americans who fit certain definitions under the Indian Healthcare Improvement Act. So those, I know I'm going fast. This is briefly an outline of how there's going to be new folks subject that states will have to identify and screen for exemptions and connect to work if they're not already connected. I find this, so given that the time limit affects very poor folks who often face additional barriers to work, and the time limit itself doesn't help people get jobs, our approach is to make sure only those that are subject to the time limit actually end up subject to the time limit. Historically, states have sometimes struggled, and folks who should have been exempt or maybe had hours working that weren't captured got cut off of SNAP. I think the goal is to make sure that those folks don't end up on the time limit and running out of SNAP after 3 months. So this is just a visual. You can really see it as a funnel down to the folks who are subject to the time limit, who are at risk of losing SNAP. Next slide. So one of those funnels is exempting people from the time limit. So I just wanted to list out, and I'm not going to go through in great detail what those exemptions are, but just note that SNAP has several different work requirements. We're talking about what we call a time limit or the 20-hour work reporting rule requirement, but there's a sort of basic work requirement that has a set of exemptions, and anybody exempt from those is exempt from the time limit. So I listed all of the general work requirements. Some of them, they're pretty obvious things. If you're already working, you're exempt. If you're an eligible student, SNAP has its own complex rules about student eligibility, but if somebody is actually eligible as a student, they're not subject to any of the other work requirements in SNAP. People with physical or mental barriers to work, people who meet TANF or your state's cash assistance work rules. So you can see those all there. I note that because not all states screen consistently for those general work requirements, and that's one way people fall through the cracks and end up subject to the time limit. Next slide. And then there's actually exceptions just for the time limit. So just add these to those, you'll get a nice long list. And I put in red here the changes under the reconciliation mega bill. If you're under 18, over 65, if you have a child if you don't have a child under 14, you're subject to the time limit. If you're pregnant, again, if you have physical or mental barriers to work, and if you're already exempt from the work requirements. Those are the other exemptions that states will have to identify. So screening is really essential, right? And there are some requirements for states that help protect individuals or ensure that only folks subject to the time limit end up being put into the time limit sort of category. And I'm just going to highlight some of those protections and note kind of where they are for folks to dig in more if they have questions. There's regulatory requirements now that the state has to screen all work registrants for all exemptions, so those general work ones and the time limit ones, at certification and recertification. That seems sensible, right? The state agency is kind of taking a look at the case to establish eligibility. Good time to screen to see if somebody's status has changed. Maybe they have become physically unfit. Maybe now they're pregnant. Maybe they're taking care of an incapacitated person. Those changes will create exemptions from the time limit, and the state can only know that if they're asking and actively screening. Next slide. So here are some good questions for a state agency to be considering. Are they actually doing the screening? Are they doing it at the right times at application and recertification? Have they defined like a physical and mental barrier to work in such a way that really captures what it means for somebody to have to meet a 20-hour work rule? So it's not just having a disability or getting a disability payment, but it could be a note from a doctor, another sort of verification from a medical professional, Could also be the eligibility worker or the state agency just determining that somebody's unfit for work. So there's a number of options, and a state should have a set of policies that really reflect the realities that folks have so that if they're even in a temporary status where they can't work, they're exempted from the time limit. Excellent. How would someone know if they're subject to this complicated rule? Well, states have to tell them. So that if the states screened effectively and identified somebody that is subject to the time limit, they need to provide what's called a consolidated written notice and an oral explanation of all the work requirements. We're focusing here on the time limit, but there are the general work requirements and even in some states, mandatory or required employment and training activities. So they have to actually tell people. I'm not going to lie, it's a pretty complicated form to get through all that information because it has to say sort of what the responsibilities of the individual are, how they can meet the various requirements, but it has to be understandable. There is a sample notice in the toolkit that FNS has available. So that's a link on the right-hand side worth looking at. States can probably improve on that, and it's really helpful because understanding this complicated rule is one of the first and most important parts of being able to comply with it. Next slide. So somebody now knows they're subject to the time limit. Maybe they're meeting it, maybe they're not. Maybe something happens to them, and they're not able to keep the job that they had, or they had to stop going to the employment and training activity that was meeting the 20-hour work rule, or the combination of two, but they're no longer meeting it. A state has to actually determine if someone had a good cause before they can disqualify or terminate someone from SNAP. So that's a circumstance beyond the individual's control that impacted their ability to meet the requirement. And states are required to check for that before they actually terminate. Historically, not sure that's been happening consistently, but it's really essential because oftentimes it is something that's happened that's allowed or made somebody unable to meet a requirement. And a classic example would be if somebody's in an employment and training program, it happens to be, 45 minutes away by car and their car breaks down and they miss one or two sessions, they may actually be terminated from that employment and training activity because of the rules that the provider has. That provider might do that because they want to make sure people are attending and they've got people on wait lists or whatever. But that could actually impact their ability to get SNAP if a state doesn't check to see if there's good cause. So I've listed a few state examples we know where states have done some screening. That's not an exhaustive list. I think states should think about what are the circumstances where somebody might not be able to meet a requirement and make sure they do that screening. Excited? So again, some questions to ask. Does the state actually do this good cause screening? And do they have clear policies of what it looks like? Is it easy for somebody to sort of self-declare that they've had a problem that could qualify for good cause? Does the eligibility worker do a check before sending a termination notice? Next slide. I see some things in the chat. I'll try to get to them when I'm done. So thanks for those questions. They look like good questions about some of these complicated rules. I also just wanted to flag some verification rules, and I actually buried the lead on this one. I think it's important to note that for exemption status, self-attestation or the individual explaining their exemption does suffice for documenting that the exemption exists if it's clear and not questionable. If it's questionable, there's a set of policies states have to follow to follow up on unquestionable or questionable information on all sorts of things, including these provisions around the time limit. There are kind of special rules, though, for verification of these exceptions, which is that states really have to try to verify an exception using information already available to the state agency. That's different than other kinds of verifications the state might do. So it's important to make sure a state realizes that they first got to look for verification somewhere before asking additional information of the individual. That just seems like a sensible rule, given that these folks need to stay attached to SNAP, and so the agency should be looking to see if there's documentation if they need more documentation. Next slide. I'm going to blow through these because I think I've gone over my time. There's another set of complicated provisions available, which are usually called discretionary exemptions. These are things states can use to exempt somebody from the time limit. I've put the rules there. If you just want to tick through these next few slides, there's lots of ways. These are ways that states actively have used these exemptions. Lots of ways states can use those. And I'm happy to follow up with more on that. So, and these are my final sort of thoughts. The error rates, I think I already mentioned, are really going to impact how time limits are implemented and the impacts on individuals. We don't really know how QC might handle quality control, might handle some of those things. There's some complications around the age limit now that it goes up to 64-year-olds. And I'm happy to answer questions in the chat about that. There's also impacts now if somebody loses SNAP because of the time limit, but they have kids in their household. The whole household loses benefits, and how that's tracked and administered is going to be a headache for state agencies. And then finally, just so what's a state to do? There's been very little guidance from FNS. They say there'll be more by the end of this month. We'll see what that says, and some of what I say may be adjusted because of that, but really, really would be helpful to know what's expected of states as they try to implement these rules.
Ooh, thank you, Ed. That was fantastic. Hi, everybody. My name is Alicia Kone. It is my honor to be here with you today. Not necessarily my pleasure to be at this point in our Health and Human Services history, but what I'd like to talk to you a little bit about over the next 10 minutes is lessons that I've learned as I've worked both as a state administrator. My career in health and human services, and specifically in employment and training, started in 1997 when, fresh out of policy school, I was hired by the Washington Department of Social and Health Services to help write the rules for and implement our TANF program. And since leaving state service in 2005, one of the consulting practices I've specialized in is working with states to help them stand up and evaluate voluntary SNAP ENT programs in particular. So just want to say that, a lot of the advice I'm going to provide you today, really I've learned through all of the incredible managers that I've worked with over the last almost going on 30 years now. Geesh. Whenever we do work with agencies, we recommend they take an incremental continuous improvement approach to change, because we think that works best and it's less risky and it gets the best results. However, our best interpretation of guidance so far, which is pretty slim, is that a November 1 deadline is going to be required for SNAP agencies to comply with the new rules. That is not clear yet, but what I'm hearing from my county and state clients is that's what they're planning for, to be sure that they're not going to impact their error rates, which, as Ed said, has become much more critical. What I'm encouraging us all to think so I know that continuous improvement cycles aren't possible in the next 30 days, but can we think about November 1 as the beginning of our first pilot? And let's plan that we're going to have to improve, and that every 90 days there's an opportunity for us to look back and figure out if we're doing things in a way that's making sure people can continue to maintain access to the program if they're eligible. So I also just want to put a plug in, if you're not familiar with the SNAP to Skills project, which is an FNS funded project in collaboration with Mathematica Policy Research. They have a website and a bunch of really good information that has supported states in standing up voluntary ENT programs, and also supported the few mandatory programs that have been out there. So kind of based on all that good work, the 5 things that you'll want to be thinking about with your states are, where's the planning effort happening, and what does that planning effort look like in terms on what they're focused on. Got to understand your processes so that you can prepare and equip your teams. And I'm talking across partners, state agencies, CBOs, ENT providers, advocates, everybody. You got to know your data and potentially set your systems up to collect new data. And again, just really encouraging people to think about this as an experiment, and that we're going to have to correct over time. So there are a lot of program decisions that need to be made during this upfront planning phase. And these come from, again, my experience working with states standing up voluntary programs. Right now, one of the big ones that I would point out that you want to tap into is what's your state going to decide to do about the certification period length for their SNAP able-bodied adults? Because there's some options there. And, you know, there are pros and cons to a 3 versus a 6-month certification based on whether or not you're primarily concerned with participation or primarily concerned with access. So I would definitely recommend you tap into that. Ed's already talked about the fact that there are other ways to meet your work requirement besides paid work. So, you know, find out what your state's plans are, your county's plans are, or if you are a state or county, begin to really think through, well, what other activities could we connect people to so that they can maintain eligibility, like volunteer work or community service work, like Ed mentioned. And then how things are going to get verified. Ed's already talked about some of the ins and outs of that. That's going to be really key for you to tap into. Just a plug for that community service or volunteer option. Whenever I work with the state, I really emphasize this because I find it is highly underutilized. This is unlike workfare, where it does not have to be like a formal contract between an agency ENT program and a provider. This can be initiated by the client themselves. As Ed said, it could be volunteering to help a neighbor out who's having a hard time. It could be initiated by a CBO. A CBO could say, hey, we are providing opportunities for you to meet your work requirement. The other cool thing about this is it will reduce the number of hours they need to participate because there's a rule that says you can't make people volunteer for more than the prevailing minimum wage. So take a full one-person SNAP benefit of around $300, it's like $292, but $300 a month divided by your prevailing minimum wage is going to be a heck of a lot less than 20 hours a week. By my calculations, with using $15 an hour, it's more like 4.5 hours a week that people will need to volunteer before they've met their requirement. The agency hesitation around this is QC, because how the heck, when a QC comes back a year later and pulls that case, are you going to find out whether or not that person actually volunteered for 4.5 hours for their neighbor? And so typically, what I work with states is figuring out how to overcome that barrier. This is not a magic bullet, but it's an empowering option because clients and community partners can take this on without having agency participation. Ideally, it's best if it's a partnership, but it doesn't require it. Go ahead. So in terms of understanding your processes, I just want to highlight a couple of things on this slide. Oh, I should have said up front, I apologize, this dived right in. Yes, we are sharing these slides. Actually, you're going to get more information in the slide deck because we've hidden some slides because we don't have time for them. So yeah, we'll share the full slide deck and unhide all the slides. And we encourage you to continue to use the Q&A function to ask your questions in real time. We do have a Q&A portion planned for the end. But anyway, in terms of this, I just want to point out two things. The first two processes, the identification and screening and notification to clients, as you heard from Ed, are what's required. States have got and counties have got to figure that out. And there are ins and outs to both of those things. The third part, client engagement and case management, is not required. States don't have to do that. And there is no additional funding to help states do that and counties, even if they wanted to. They'll have to come up with that themselves. That's the place where the quality of the implementation is going to vary. And one place where I would say, as community partners and advocates, you have more room to really push and potentially fill that gap. Okay, but you got to understand what the state's planning. This is an example of, did some work in Cuyahoga County. This is just the process for referring an able-bodied adult to their SNAP to Skills program. So I'm not going to go through this, but just to say it's complicated. And this is just one step or one piece of their whole program. Go ahead. In terms of preparing and equipping your teams, there are going to be lots of questions. I've provided an example of the most commonly asked questions that we've addressed in FAQs and previous implementations I've been involved in. The training plan obviously also matters. And I'll just say, even though it feels pressured on the SNAP side to get something out, it does not pay to do training wrong. Like, train it right for the first time. And if you have to say, we don't know yet, that's okay. Like, it's okay to train what you know and only what you know. Go ahead. Lots of different tools that states have developed to support these processes, which are fast moving, tip sheets, automated screening tools, electronic verifications, automating the paper forms, but also having paper forms for those folks who still live in a paper world. What I'll say about that is whatever you create to support this and support the participants, keep it simple because the policy is super complex. This is an example of something Cuyahoga County created. It's, this is intended to be a paper form. It certainly could be automated that would help a client self-screen for their work registration status. So whether or not they're exempt. Go ahead. These are a couple of examples. One on the left is an example of a form that we created when we were working with Alaska to stand up their voluntary program. You can see in this case, they were primarily concerned with some kind of paper verification of volunteer or education hours, because they had sorted out that all the other activities they were going to be able to verify through another means. But the only thing they were going to need clients to submit was a paper verification of their volunteer education hours. On the right, plug for my former employer. This is Washington DSHS form. You can see this form has multiple different categories of activities someone could use to meet their work requirement. And the idea is these get signed. And there's some kind of contact information for the agency that's provided the volunteer, or the person who's provided the volunteer work. So in terms of knowing your data, the issue with this is you're going to want to track what's going on monthly, again, because it moves so quickly. We're really talking about 3 critical months and a fourth of a little bit of grace period. So you're going to want consistent procedures. You're going to want to be checking things routinely, hopefully even more than monthly. And you're gonna, one of the things that people don't understand about the time limit is people can regain eligibility. It's not like once they've used up their 3 months, they don't come back for 3 years. They will come back the following month and ask you why they didn't get their benefits. And then you're gonna say, well, because you didn't participate. And they're gonna say, well, I'll participate then if I need to. And as soon as they do, then they're back on and they get another 3 months. This is a revolving door for most agencies who've been implementing mandatory programs. Go ahead. Some of the things you're going to want to pay attention to for quality assurance, those monthly reports, you're going to want to report by the folks who are in month 1, 2, 3, and the people who are in regain months, because those are critical points to track people through. You're going to want to know whether or not the work registration status or the exemption was done correctly. And that has to happen for each month. So when QC goes back and reviews those cases, they're going to determine that on a month-by-month basis. And then this regaining business is something else you're going to want to make sure you go back and people are not, that is not being missed. And people maybe are not being put back on when they should have been. And then, of course, there's all the timeliness of notices of action to pay attention to. This is an example of a report. Again, this comes from Cuyahoga County, just for consistency. These are all the different categories of ways that they are tracking their ABODs. Go ahead. So, and then finally, please, 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 I know that it seems like we're on a fast track, but let's think about this as an experimentation period and not, pour things in concrete, and give us an opportunity to fix things, because it's going to be bumpy and we're going to need to modify things as we go along. So finally, last slide. So I would say the big kind of headline advice that I would give you from my experience working with other states is first and foremost, SNAP, able-bodied adult time limit policy is fast moving. If you're kind of used to TANF time limits, that we're talking 60 months in TANF, and it still feels like a whirlwind. We're talking 3 months here. Screening is critical. That is the most important step. Like Ed said, first figure out who isn't even subject to it and can just be set off to the side and continue to get benefits as usual. Timesheet management creates a lot more paperwork for agencies, and the extent to which community partners can help with that, it'll make this process go more smoothly and keep more people connected. And then you got to plan for what's going to happen when people inevitably lose their benefits, because people are going to go without. Even if it's only for 1 or 2 months before they can regain, there will be periods of time when people are not getting the food that they need. We are providing our email addresses at the end of this slide deck, and all of us are happy to follow up with you individually. I know that was a whirlwind, which I am now passing on to Elizabeth to continue to keep going. Thank you.
Yes,
Take it away,
I will
Elizabeth.
flag we are answering questions in the Q&A. If you posted them in the chat, actually, it would be really helpful if you reposted them in the Q&A, because that makes it easier for us to answer them. I'm going to talk very briefly about what's actually in the Medicaid work requirements. Most of my time I'm going to spend making the suggestion that everyone think about the Medicaid and SNAP work requirements together, maybe not right away, because obviously the SNAP ones are coming right away, and we've got a little time on the Medicaid, but I don't think we can wait until 2027 to think about them together. So briefly, under HR 1, OBA, whenever we're calling this bill, it requires Medicaid work requirements in all states for the expansion population. The expansion population includes over 20 million people. A lot of them will be exempt. Many of them are already working, but states are going to have to figure out for all these people what category they are in. The requirement does take effect January 1st, 2027, which maybe seems like a long way away, but will be here very, very soon. States have the option to start earlier if they choose. I hope that they will not. State HHS is going to issue an interim final rule next summer that will give states extremely little time to build. This is a very new policy. Even the waivers that we saw under the first Trump administration that let states experiment, try work requirements until the courts decided that they were not appropriate, are very different from what's in this bill. So this is really unknown ground for Medicaid agencies. The work requirements will apply to childless adults, but also to some parents in that expansion population with older children. One thing that's kind of quirky that I don't think people have caught is how the income cutoff for who's in the expansion population actually varies by state, because it depends on how broadly states had covered parents in Medicaid prior to the Affordable Care Act. So there will be some quirks of similar people in different states, some being in the expansion population and some not. Next slide, please. The thing that's most challenging, problematic about the Medicaid work requirements is that they are a condition of eligibility. People who are newly applying for Medicaid must be meeting the requirements prior to enrollment unless they qualify for an exemption. The statute even allows states to require up to 3 months of compliance before people can be enrolled. And that's just really hard to think about how that will work in practice, because many people either don't have health insurance, and when they go to an emergency room or a hospital and seek care, they discover that they're eligible, or many people even think that they have Medicaid and don't realize that they've somehow fallen through the cracks. It's lapsed. Currently, people can show up, they can get enrolled, they can even get retroactive coverage. This is going to be extremely difficult for states. It's going to be even more problematic, I think, for hospitals and other primary care providers that are going to have to sort this out as people walk in their doors. I think no matter how states handle this, this is going to result in delays in care, in Medicaid debt, more uncompensated care, as well as people, walking away without treatment, not filling prescriptions and things like that. It's a little confusing even more to think about how this is going to apply to ongoing recipients. There's not a lot of detail in the statute. HHS is going to have to fill in the details, but states are going to have to check participation at least once during each 6-month renewal period. Yes, that's 6 months. Currently, most people only renew Medicaid once a year. One of the other changes in this bill is to require 6-month renewals. There is some opportunity to make a satisfactory showing of compliance. It's going to be really complicated. And I think it's going to be important to think about how the two programs can work together to make this a little bit simpler, to reduce the confusion. Next slide. Just as a sense of the scale, Urban Institute estimates about 12 million households receive both SNAP and Medicaid currently. That could actually probably be a little larger. Some of these folks that are in the one program only could probably be eligible for the other, but are not currently enrolled. Next slide. So I'm going to talk about 4 ways to leverage cross-program implementation to reduce the burden of the work requirements. Next slide. So the first is to really think about the data sharing. This is a slide about Arkansas's Medicaid waiver work requirements. You don't need to get into the details, but I think the main takeaway I want you to have from this is most people who were subject to the work requirement, in theory, were exempted from the reporting requirements because Arkansas was able to look at their data, see that they were already participating in SNAP, that they were already working, and take them out of the universe who had to report. Of those who were subject to the reporting requirement, nearly 90% failed to report it and wound up losing benefits. So as soon as you're asking people to submit pieces of paper, to get online and provide information, our historical record is that people are going to find this a barrier and not be able to access the program. So the first thing is because of this data sharing thing, I think getting people enrolled in SNAP is actually going to be a really helpful way to preserve people's Medicaid. Because if people are in SNAP households and are subject to SNAP work requirements, by statute, they're exempt from Medicaid work requirements. So particularly if you're thinking about this requirement that people have to be either exempt or participating before they can even be enrolled. For many people who are not currently working, the easiest way upfront to get them enrolled in Medicaid is for them to be subject to SNAP work requirements. I will flag that this is a one-way door. There's no automatic SNAP exemption for people meeting or exempt from Medicaid work requirements. Next. Data sharing, I am not going to get into all these details, but just I think often people really focus on the technical piece of this about can we actually build linkages across programs, and that the reality is that we need to think about all the different pieces. Are we allowed to do this? Does the policy actually match up with the data that we have, or do we have to fill that gap? Do we have to pay for each data match? Some states are paying $20 more every time they call up someone's employment history, and that adds up to a lot. and also potential unintended consequences. If you know that someone's income has changed in SNAP, you do need to recalculate their benefit level. Next slide. Align the exemptions when possible. This is what happens when you write big bills at 2 in the morning. You get really messy, half thought out policy. The bill does not fully align SNAP and Medicaid exemptions. This is super messy, and it's going to be important to look and see where there is flexibility to adopt shared definitions to deem. In the chat, someone asked, was this that we heard about volunteering under SNAP? Does that apply to Medicaid? The answer is, we don't really know. I would encourage states to assume it is, to act as if they can apply the same rules to Medicaid that they're applying to SNAP, but it is possible that CMS next year is going to come out with a different policy. So that's something to keep an eye out for. Next slide. Again, given time, I'm not going to go through all the details, but this just shows some of the ways in which the statutory exemptions don't quite line up. We heard about good cause under SNAP. The Medicaid statute does not actually say anything about this kind of good cause other than for, immediate health crises, but things like loss of child care, transportation failure, your house burning down. Next. Coordinate the communications. People are going to be really confused. They're going to get messages saying to report information that they just that they think they just reported to another agency. They'll be frustrated. They'll get notices saying they were cut off from one program, and they'll think that means they've lost both. So really think about, how do you be clear about what program this applies to? Can you use the same form, same information? Test what you say. You may think it's clear. You don't know that until you've actually put in front of recipients and asked them what they think the next step is that they're supposed to take based on the piece. Next slide. And then looping back to some of the points that Alicia made. The bill does not provide any funding for Medicaid work requirements or work activities. But if people are receiving SNAP, they can receive work activities that are funded under SNAP ENT. And this slide is also from that SNAP diagram, is from the SNAP to Skills website. It really is a useful resource. I could do a whole webinar just about SNAP ENT, but just about if you want to make this not just a way to kick people off of benefits, but actually provide case management, provide training, provide job search services, the only funding that you've really got out there is going to be SNAP ENT and existing workforce programs. Next slide. And just flagging that I've got some more resources that I'm happy to share on my website. So with that, I will hand it back to David and let him do his presentation.
Thank you, Elizabeth, and thank you, Ed and Alicia. And as this trio has laid out, there are very difficult complexities that we are all contending with in real time on ABOT compliance. As each panelist has indicated, probably do another hour on each of these topics, and it would not be too difficult to do so. But we also know that states are moving exceptionally fast to try to meet this November 1 compliance deadline, although absent any additional or further guidance from FNS, which we might keep our fingers crossed for. But with this sort of fast looming deadline in mind, we at Beam have been working really hard to try to do what we can to show up for states and counties and the community to see how we might support the determination of ABOT compliance in a lightweight way that acknowledges the ticking timer that we are all under. So by way of background, again, on Beam, we offer a low-code solution that is geared towards allowing for quick configuration of the most complex rules regimes and eligibility determinations that can be implemented in weeks rather than months or years, which is quite critical in a moment like today. So we've spent the last couple of months collaborating with community members in the space that have included human services leaders at both the local and state levels, and we have put together a configuration that can help states and counties more easily manage ABOT compliance, where we have focused specifically on issues of exemptions, workfare, volunteerism, unpaid work. Some of the elements of, as Ed and Alicia indicated, are a little bit more tricky to verify. And as we think about sort of what a solution like this needs to entail, it needs to acknowledge the conditions that Ed laid out at the top, that the folks that are going to be likely needing to meet these compliance requirements are some of the folks dealing with the most adverse situations. So how do you think about really designing for that use case, reducing administrative burden, trying to sort of make it as easy as possible to submit the necessary proof, while also supporting caseworkers that are going to be dealing with a QC colleagues who are going to be thinking in the most draconian terms. So that is sort of the background. Given we only have 10 minutes, I will be unable to capture all of the complexity in 10 minutes, but this is exactly what we anticipated. So what I'm going to do is I'm going to walk through a very high level workflow of how this might work, which of course can be and would be further configured to speak to the unique context of any states or counties. We know that most states have large incumbent systems that will need to be reworked in some form or fashion, and this solution could either be layered on top of an existing eligibility determination system via an API or run alongside it. And we have our own reporting API that can ensure reconciliation of records if it is indeed working alongside. So what I'm going to start with is what a flow might look like holistically, where we would want to capture the scenarios I mentioned, but this is what it might look like for a likely exempt individual. So, this gets back to best practices in application design, how you're sort of speaking in clear language that asks about situations that may or may not apply. If there is a situation here, this is a really good opportunity to leverage, very basic AI, whether it's us or someone else, where you have large models like OCR, LLMs have gotten quite good at reading documents to start to derive intelligence out of this. Alicia mentioned that this is a best practice that states might use. So this is an area where you can actually start to put the burden back on the state from an eligibility determination standpoint, where you actually have very reliable intelligence within some of these technologies to determine whether certain exemptions are met. And I will speak to where in our system that would occur. For those that are unlikely to be exempt, there are things around volunteerism that we want to try to make easier. This also gets to a use case that Ed called out around if you are working with an aging neighbor and you're providing sort of in-kind services to support that individual, how can you acknowledge that that might be a low technology use case where you have nonprofits in the community that are unlikely to adopt a new system wholesale, where you're working with folks who may not be that fluent with technology or devices. So you can select something in a drop down like this. You could select multiple things. I'm just going to go through one because that's the simplest flow. And what we are thinking about is both the applicant, but also the QC official as well. So there are multiple databases that actually have 501c3s where we can validate sort of valid 501c3s. Now, of course, that doesn't capture the individual use case where you can also enter in the names of individuals, religious organizations, or others where volunteerism might have occurred. Alicia showed some really good examples of documentation that states might use to allow for the uploading of documents. Otherwise, forms can be filled out manually. But again, this gets back to sort of documents intelligence, where you can upload a document and then the system itself can sort of extract the intelligence, the information, and make it clean. The part of this that is really, I think, important for QC is how do you verify that this is real? But how do you do it in a way that also acknowledges that a nonprofit or an aging neighbor is unlikely to necessarily adopt their own system? So there are best practices where I'm sure folks have used Google Documents on this webinar, where you can actually do native verification within emails. So this can trigger either email or text message communication that would allow for a third party to verify. Again, for a QC person who doesn't think that that is enough, or for a community that believes there's an opportunity to engage nonprofits in the community more holistically, there is also the ability to create sort of a portal and an experience for nonprofits themselves. So this is something that would allow for review and verification within this system, as well as referral for volunteer opportunities to try to make salient things that could help folks with compliance, which gets to a question that I believe was asked in the Q&A. So again, this is an easy way for verification within a third-party system, not required, does not need to be leveraged for verification, but this is a way to, again, create that audit and paper trail for a QC team that, as Alicia mentioned, is often a little wary of using volunteerism as a mechanism for demonstrating compliance. The other piece here is then, of course, the case manager experience. Now, Alicia laid out the Cuyahoga workflow. That is quite complex. The sort of the workflow here is fully configurable to meet whatever sort of workflow regime is necessary. One of the things that we wanted to focus on was really the time limit problem, is making sure that eligibility determination and ABAUD sort of action steps are being taken, understanding the urgency of the ticking timer, where we do create sort of that very transparent time limit status. And our system also supports communication both at the individual level and at in bulk. So, using some of these understandings of time, this is an opportunity for the referral of different volunteer opportunities or engaging folks that may be at risk of seeing their 90-day time limit run out, where you can actually send out the right correspondence in timely ways and prioritize the folks who are closest to seeing those 90 days run out. And of course, this is also a place to holistically ensure compliance. So things that we can do, collecting documents across that portfolio of different ways you might need compliance, because it's volunteerism hours plus workfare hours plus. The system can do the aggregation of that and sort of share what the total hours looks like. This can support the back and forth two-way communication with an applicant. It can support note-taking and sort of notation around good cause. And it can support sort of moving the case through a workflow. So again, we understand that there is usually a system in place. It is usually built by a large vendor that may or may not need to be named, but how to interact with the existing infrastructure is going to be really important. And for us, we've built with interoperability principles in mind. So yes, we can offer a self-contained system. However, we have built such that we have an API. We also make it very easy for partners to either download or access any of the relevant information so that it can reconcile with cases in the native eligibility system of record. So this is something that we are prepared to do. It's something that we are prepared to do quickly. So again, this configuration is at the ready. It's ready to go. It is something that we, of course, would want to collaborate with states or counties in county administered states on if and how this can be supportive to whatever context is relevant, given we are 36 days out from November 1st. But again, wanting to get something appropriately robust, but also lightweight given sort of the conditions and circumstances that we are under. So that was a very quick run through, given that we are blazing through to 2 p.m. Eastern, 11 p.m. Pacific. So there's a couple of minutes left for any outstanding questions that have not yet been answered. And we'll see if anything comes through in those last minute or so. Otherwise,
I want to apologize. I accidentally hit answer live to one question, and then Laura and I were trying to fix that behind the scenes. But just to make sure that your question got answered, the minimum wage rule for a community service is the prevailing minimum wage. So that would be your local minimum wage in the area where the participant lives.
And as all of our panelists have indicated today, everyone on this call is ready, willing, able, and eager to support where possible. So everyone's email address is here on this slide. All of these slides will be shared with everybody on the webinar. If you are interested in learning more about the solution that Beam has developed and whether there may be an opportunity for us to be supportive as your community starts to implement these requirements, my email address, david@bybeam.co, is here, and we welcome anyone to reach out, whether about this or otherwise.
Ed, I've been looking for a link to that FNS guidance that I've mentioned a couple of times. Do you happen to have it handy?
I think I do. I thought I put it in the chat, but
Oh, fantastic. So to the person who just asked where you can find the guidance, there's a link in the chat.
well, I think it's just to the hosts. I can't get it to everybody.
Okay. So maybe Laura, you could repost it.
I just put it in the chat. I will note FNS has not, they posted like a sentence of guidance
Yeah.
on work requirements.
Yeah.
They have said more is coming by the end of the month, which is less than a week away. Both on this and also on the new immigrant restrictions that were included in the law. I know states and lots of other people are watching with a lot of concern to see what guidance comes out. And as soon as it arrives, we will all be reading it carefully and possibly updating our slides if it contradicts anything that we've shared.
And also crossing our fingers that a federal government shutdown doesn't postpone that guidance.
Yes.
And on that optimistic note, I would like to thank Alicia, Elizabeth, and Ed again. And again, for everyone who was on the webinar, thank you for attending, and wishing you all a good rest of your Thursday.
Yeah, and just to clarify, for those that are asking for a link to the slides, I believe Marjorie is going to email them out to you.
Yes, that's
perhaps a couple of other things. Yeah.
all right.
David, thank you, Laura.
Thank you, everyone.
Marjorie.